Now, World Oral Health Day 2023. Be proud of your mouth. On March 20th every year, we ask the world to unite to help reduce the burden of oral diseases, which affects individuals, health systems, and economies everywhere. What is World Oral Health Day's purpose? The World Oral Health Day aims to empower people with the knowledge, tools, and confidence to secure good oral health. Why is World Oral Health Day so important? Oral diseases are a major health concern for many countries and negatively impact people throughout their lives. Oral diseases lead to pain and discomfort, social isolation, and loss of self-confidence, and they are often linked to other serious health issues, and yet there is no reason to suffer. Most oral health conditions are largely preventable, and it can be treated in their early stages. This oral health interview is proudly brought to you by SADA. SADA's vision is to be recognized as the trusted leader and voice of oral health care in South Africa. Their mission is to promote the interest and serve the needs of our members and, above all, encourage optimal oral health care for all South Africans. You can learn more about SADAG, the South African Dental Association, by visiting the website www.sada.co.za. Also be sure to check out more about the Young Dentists Council. Now, this afternoon, we do have a special guest on the line, and that is Dr. Ngwetjana. Good afternoon to you.
Hi, how are you doing?
Doing very well. Thank you very much for Thank you very much for joining us this afternoon and for your time as well. Before we get into the chat for today, I just need to introduce our guest to who you are. Now, Dr. Ngwetjana, she's a young doctor who began a journey with a BSc, a Bachelor of Sciences qualification. Now, this was followed by a Bachelor of Oral Hygiene degree and lastly a Bachelor of Dental Surgery degree. She attained all the qualifications from the then Medunsa and currently Sefako Makato Health Services University. She's currently in her first year of serving as an independent practitioner. During her studies, she served in the University SRC and was also a part of the SMU Golden Key Society. She has been on the TV show Expression for an interview during her SRC days. She possesses a great passion in maxillofacial and oral surgery. She enjoys outreach programs as well as giving oral health education to both children and adults. In addition to being a dentist, she also has a keen interest in running small businesses. This is her way of reaching out to communities to provide oral health education whenever the chance presents itself. She's a strong believer in encouraging the youth of today, especially young females, to always aspire towards their dreams regardless of societal beliefs, norms, or dictations. As a member of the Young Dentists Council, Dr. Ngwetjana would like to reach out to other young dentists like herself to share knowledge as well as to build relationships that will encourage quality service delivery to all. She was an exchange student who went to Germany during her high school days, and this sparked her passion to explore and learn different cultures and interact with the world as much as she possibly can. She enjoys showcasing her work on online platforms such as Instagram and Facebook to bring about awareness about dentistry and everything oral health related. While she's not actively working on a career, she enjoys spending quality time with loved ones, reading, and going on adventures. And it seems like she has many adventures to share. So good afternoon once again to Dr. Ngwetjana. How are you doing today?
I'm doing perfectly well. How are you doing? Except the business at work, but otherwise everything is A for always.
Well, it seems like you're very occupied with work, so let's get into it. Now, I'm very keen to hear, why is poor oral health common in the elderly?
Well, I think we all know that dental caries remain a major oral health problem among the elderly, the young, literally everybody. And in elderly people, it's mostly age-related because, you know, when you grow older, your organs start not working or functioning correctly. For example, many aged people suffer from salivary changes. And this is mainly due to the medication that they take. Remember, most old people go through changes. As such, they eventually find themselves in situations whereby they actually taking chronic medication and, you know, literally in pain all the time, buying over-the-counter medication and such. So basically what happens is that during this period, that's when you find yourself in a situation where side effects of the medication then become a problem. And then also, the other thing that people usually go through, especially with aging, is also oral cancer or cancer therapy, tobacco, alcohol use, recreational drugs as well. This is because they cause serious or thick saliva flow, which then leads to a splitting out regularly. And most of the time when there's no saliva function in the mouth, it means that your mouth is dry. And when your mouth is dry, you don't get to cleanse the mouth regularly. So that is part of the reason why elderly people undergo oral health problems. The other thing is poor diet. I mean, old people don't generally care about their diet anymore. So they don't take vegetables, they don't take fruit as much as they should. So they basically would go for something very sweet because they're living their best lives at that point in time. And when one does that, that's when you start seeing that there's actually going to be big problems with regards to the oral cavity. And I think the other thing is exposure of food service by gingival recession. And this is usually when the cementum, which is the root part, is actually showing in the mouth. And when that happens, because that surface is a bit harder than the enamel that we all know, it becomes easy for bacteria to attach onto the cementum. Therefore, it causes then calculus, it causes other problems. That's why elderly people actually undergo oral problems a lot more than younger people do.
All right. Now, moving on to the whole elderly thing. I mean, as we get older, people lose their teeth and you start replacing it with dentures and so forth. I just want to ask, is it impossible to have dentures when I have bony protrusions?
Oh, no, definitely not. Remember, with bony protrusions, it's either cancerous or not cancerous. But most of the time, the ones that we see when people want dentures are not cancerous. So basically, there's a procedure called alveoloplasty, where the bone is exposed and then it's grinded down to the same level as the rest of the arch bone, or rather the palatal bone, depending on whether the protrusions are in the mandible or in the palate.
Okay.
Right? So it's not difficult or even impossible to get dentures when people have bony protrusions. It's quite easy, actually.
Okay. Now, another question I want to ask you is, what is xerostomia? What causes it, and how can one cure that disease?
Okay, so xerostomia is basically a medical term for dry mouth. It may be caused by multiple factors. For example, aging, like I said initially, medication that the elderly people would use, and that comes with side effects. Sometimes people get salivary stones, and this is also common in the elderly. Some people have an autoimmune disease called Sjogren's syndrome, and this is most commonly found in people that actually suffer from xerostomia, right?
Okay.
And we also have diseases like your diabetes, your asthma, your kidney failures, your HIV as well, that also causes xerostomia. Stress, anxiety, depression as well. And this is mostly because when you're stressed, your body does not perform at its optimum level. So that is why people end up not having enough salivary flow, resulting in xerostomia. And also radiation, maybe if you have a cancer of the head and neck, that also can cause nerve damage, eventually leading to xerostomia as well. And usually the treatment depends mostly on the cause. Common dry mouth remedies include limited caffeine intake, avoiding the use of tobacco, frequent intake of water, especially for people that generally don't like taking water, like myself. I'm not a water person, but that actually helps a lot. And we also have saliva substitutes like your gum or candy that contains xylitol. I know in Clicks you guys do actually have gum that has xylitol in it, and also sugar-free gum also works out perfectly fine.
All right. Now, thank you very much for sharing that. And yes, I know most of us are very, very guilty of not consuming enough water or consuming too much coffee or caffeine and so forth.
I thought I was the only one.
Not the only one. Just on that topic, in store at Clicks today, you can enjoy some great oral health at absolutely incredible prices. Now, switch and save to trusted quality and great value with the Clicks oral products. Buy any 3 and get the cheapest one free. That's the Clicks range of oral products. Buy any 3 and get the cheapest one free. So if you do pick up the You Pay Less leaflet, you'll find more details in there, and they are valid until 11th April while stocks last. Now, Dr. Cookie, we've actually just touched on a few very important things there now, but I want to ask you the next question, which is, what are the most common cancers found in the mouth?
Well, there are a lot, but the most common one, which is found in more than 90%, is oral squamous cell carcinoma. And this is because of the squamous cells that are usually found in the mouth. So the common signs with the cancer would usually be like your lips or your mouth are sore, and then they bleed easily, they don't heal within 2 weeks. There's rough spots or crusty areas in your lips, your gums, or inside your mouth, and you don't know where that's coming from. You don't know what to do about it. Sometimes it causes numbness, pain, or tenderness on the face, the neck, and even around the mouth areas, which occurs without cause. Like, you know, when sometimes you wake up and you're like, oh my gosh, I'm in so much pain, but you don't know where it's coming from. But now this pain is prolonged, you know, and only when you go seek treatment or when you go and consult, that's when they'll be able to tell you that you are suffering from 1, 2, and 3. And then there's also difficulty in chewing, swallowing, speaking, moving the tongue or the jaw. And sometimes people come and say, I think I was eating a bone and I cut myself. But this cut has been there for like 3 months or so. And when you tell the person it's not actually a bone, it's very difficult to get patients to believe you, by the way.
Yeah.
Sometimes we see it from unintentional weight loss and chronic bad breath. This is something that people complain a lot about. So when you have chronic bad breath, please have that checked out.
Now you're actually making me really worried now, because I mean 2 out of 5 days I normally sit with some bad breath, and I wonder where it comes from, and I always check my meals afterwards.
You might be suffering from stress.
Now I want to move on to the next one. Which toothpaste is the best one to use?
Wow, what a question. As a dentist, I get this question a lot, actually, from family members, from friends, from patients, you name it. So what I usually say to patients is that, or anybody that asks really, is that the best toothpaste is one that contains fluoride in it. We all know that fluoride is good for your teeth, strengthening your teeth, you name it, it's very healthy for your teeth. And furthermore, it's better to take one that actually caters for your specific needs. For example, people that suffer from gingival diseases, whether it's periodontitis or just gingivitis, we actually have a Colgate Total 12 that is specifically for gum problems. And there are people that also suffer from sensitivity. There's Colgate, the Sensodyne, that specifically caters, for sensitivity. We also have Meridol, which also caters for gum disease. So basically, when you're looking for a toothpaste, go for something that has fluoride in it, definitely, and something that you feel caters for your needs. Whatever problem it is that you have, you'll definitely find one for you on the shelf.
All right. Now, it's funny that you mentioned the Colgate Total or the Max, because that's available right now in-store at Clicks. The Colgate Total or Max White Toothpaste, 75 mils. Pick up 2 for 85 Rand, and you save 24 Rands 98 per offer. That's the Colgate Total or Max White Toothpaste, 75 mils. Pick up 2 for just 85 Rand, and you save 24.98 per offer. Now, Dr. Cookie, I want to ask you, what are the 5 most common dental problems that you experience?
I'm going to sound like a broken record, but anyways. So one of them is your gum disease, whether it's gingivitis. So basically, gingivitis only affects your gums. That is why it's called gingivitis. We also have another one that is periodontal disease, where now the bone is involved, and when the bone is involved, it means your teeth are going to start moving as well. So these are all bacterial infections that are caused by the accumulation of plaque in the mouth. So basically, plaque forms every single day, and that is why people are supposed to brush their teeth twice a day, every day. And then there's also tooth sensitivity, where one would have enamel wear or erosion. This is usually caused by sour foods or acidic beverages,
Yeah.
So, for example, the ladies that always want to lose weight are so big on lemon water, and lemon water is a big hazard to your oral cavity. The other things are things like your tooth grinding, which also causes spasms on the teeth, your abrasive brushing. Some people literally just brush their teeth so hard that the toothbrush now becomes flat. I don't know who gets power from where to do that, but anyway, we leave it here for just now. And then also tooth decay. We all know what tooth decay is, and it's mostly prompted by eating sugary things, acidic things as well. There's also oral cancer, which is seeming to come up a lot more than I thought it would, as well as dry mouth. So these are the most 5 common dental problems that people suffer from.
Okay. Now, you've mentioned quite a few dental problems. Now, I want to find out, what are the 6 best ways to maintain a healthy oral cavity?
I was going to give you 6, but I'll give you 2 bonus ones.
Okay.
So, first of all, you need to brush your teeth twice daily for 2 minutes each time. I mean, I'm a dentist, so chances are I don't do the 2-minute drill. I brush up until I'm satisfied, or I feel that I've covered everything in the mouth. For example, people brush their teeth but leave the tongue out, you know. I don't know if they forget or it just does not ring a bell that you need to brush your tongue as well. But when we say brush your teeth twice a day, we basically mean everything in the mouth. Run your brush across your tongue, across your gingiva, you know, all around the mouth.
Okay.
Secondly, you need to floss on a daily basis. Usually, I've come across people that say flossing causes gaps between the teeth. If you're not doing it correctly, or you're using the wrong size of a floss, because there's super floss for people that have braces, but there's normal floss for people that don't have braces. So if you're using the correct one, you won't have the gaps in between your teeth. The third one is replace your toothbrush at the sign of wear or every 3 months. So the reason why I also mentioned that every 3 months is because other people don't generally use their toothbrush to a certain point where it looks like it needs to be thrown away. So basically, if you find yourself in a situation where you are that person that does not use it so much that it looks like it's worn off or whatever, at 3 months you need to change it, because it means the bristles are not the same anymore. It's not doing what it's supposed to be doing anymore, all right? So number 4, you need to visit your dentist every 6 months, be it a consultation or whatever it is, but you need to visit every 6 months. Also because you need to get a routine scaling and polishing every 6 months. And number 5 is to maintain a healthy diet. Number 6, keep hydrated throughout the day. Oh my gosh, I think I need to start drinking your water. You and me both, actually. Number 7, stay away from smoking. Smoking is a problem. And number 8, which is the last bonus one, use dental hygiene products.
Wow. Okay, so drink lots of water. That's your public service announcement for this afternoon. Drink more water. That's coming from your dentist. If you just
literally.
If you just walked in store at Clicks right here this afternoon and you listen to the conversation, we are speaking with Dr. Kuki Ngwetjana, and we are chatting about oral health care for World Oral Health Day 2023, where you can be proud of your mouth. And we've covered a number of great things that she's been discussing, and she just shared with us also the 6 best ways to maintain a healthy oral cavity, and one of the best ways is to see a dentist every 6 months. So we do actually appreciate that. And also she mentioned, very important, drink water, and we're both guilty of not doing so. Now, Dr. Kuki, I would like to ask you the next question, which is, what are the major signs of poor oral health? Now, you mentioned bad breath earlier. What are the other major signs of poor oral health?
All right, so bad breath is still a sign of poor oral health. We also have mouth and jaw pain, bleeding and sore gums, loose or lost teeth. When you see yourself losing a lot of teeth, you know that is a problem. Changes in the tooth surfaces and enamel. Unfortunately, the changes in enamel are very common when people grow older, but they're not too drastic. For example, when you grow up, your teeth are a lot more whiter than they are now. Am I correct?
That's correct.
Are they not a little more darker or browner or yellower than they were before?
No, of course they are browner. There's a lot of
so that happens because of the brushing, because of the food that we eat, the abrasive things that we use on our teeth, and. So don't take it as such that changes in the tooth surface basically means that there's something wrong that you're doing or you have poor oral health. That one is quite subjective, all right? And then also mouth sores, patches or lumps as well serve as one of the poor signs of oral health.
Wow. You mentioned a lot of things then. It's scary to think that there are actually people walking around there smiling at us. So I think
I know, right?
it's worrisome. It's worrisome. Now, I want to ask you, what is the worst that could happen if a rotten tooth is left untreated?
Oh my gosh. You know what the phobia that people have for needles and tooth extractions? This is a big problem. So what usually happens is that if it's a mandibular teeth, or rather in layman's term, a tooth that is in the lower jaw, you'd have actually Ludwig's angina, which is a big problem. It's a life-threatening disease, characterized with browny cellulitis, and in there's pus. It involves the floor of the mouth, the neck, both sublingual, submental, and submandibular areas. It rapidly spreads. It is just so bad. And when I see people that actually have a rotten tooth, especially in the mandible, I get very worried because this condition has a tendency of spreading so much that it goes and blocks your airway. And sometimes you can die from that. So imagine a scenario where somebody is actually dying from just having a carious tooth that you could actually extract and the person is perfectly fine. I mean, extractions aren't that bad after all. So most of the time, this is what we see if the tooth is left prolonged. You know, I had a lecturer at one point in time when I was still in varsity. He would say to us that you never let the sun go down on an abscess. And trust me, this is true. And the other thing that usually would happen is dental facial cellulitis. This happens in the maxillary teeth. So basically, dental facial cellulitis would then be an infection of the facial tissues. It's the same principle. When there's an abscess, the pus then starts moving around in the tissue spaces. Wherever it finds a space, it moves there. Now, the problem is that with pus, it means that your tissues are getting broken down, your cells are dying, you know, so it becomes actually an emergency. So for people not to get to that point, it's rather best to consult and have that sorted out. Instead of you staying in the hospital for like 3 weeks simply because you had a rotten tooth. Because with the treatment, it's quite imperative that whether or not you're feeling pain at that point in time, and mind you, when you are at that level, the local anesthesia does not work. So basically, you'd have to undergo general anesthesia. But this is not something that happens on a daily basis. If you come to my practice, for example, I'll use local anesthesia. But because I know the dangers, whether you're kicking and screaming, you're fighting with me, biting my hands off, I'm literally going to pin you down and remove that tooth. And most of the time when it reaches this stage, it means we need to also make a cut, an incision, open it up, drain it out, and then also give antibiotic treatment as well as analgesic treatment. But most of the time, if the patient is now in hospital, under hospital management or under hospital monitoring, then we'd also give your normal saline solution, your IV fluids to correct your hydration and the likes. But surgical intervention is quite necessary. You know, they always say, whenever you have a problem, make sure that you remove the cause. If you do not remove the cause, you are not doing anything. Like one of my lecturers back in the day as well, that man really, really disliked antibiotics. And he would tell you, antibiotics are not good for your body. So in such situations, he would just say, you know what, remove the cause and deal with whatever needs to be dealt with afterwards.
Wow. Now, that was a very, very loaded answer there to the question, which is what is the worst? And the thing, the biggest thing that I got out of that is having a doctor that's going to be pinning me down into the chair. That sounds like the worst thing that could happen.
You know, I actually love maxillofacial surgery so much that when I talk about it, I literally immerse myself into being a maxillofacial and oral surgeon. I cannot wait for a time when we speak again and I say to you, excuse me, I'm a maxillofacial surgeon now. We are chatting to Dr. Cookie Ngwetjana. She's from the Young Dentist Council, and we are chatting about World Oral Health Day, for World Oral Health Day for 2023, and we are chatting about a wide range of absolutely amazing things on how you can care for your teeth, what's the things to look out for, and many more. Now, we were chatting about teeth whitening because it doesn't get whiter as you get older, and in store at Clicks, we've got the Sensodyne Natural White, the Gentle Whitening, Clean and Fresh, as well as the Multicare, Freshment, and Herbal Multicare toothpaste. Pick up 2 for 80 Rand and you save 19.98 per offer. That's for the Sensodyne Natural White, Gentle Whitening, Clean and Fresh, Multicare, the Freshment, and Herbal Multicare toothpaste. Pick up 2 for 80 Rand, you save yourself 19.98 per offer. Now, Dr. Cookie Ngwetjana, it's almost time for us to wrap up, but I'd like to ask you for any final thoughts and how listeners can contact you. I am on Instagram as Dr. Jade Tosh. I'm on Facebook as well as Dr. Jade Tosh. And those are the mostly used platforms where you can see my working showcased, and it's easier to reach me on those platforms as well.
Okay, so it's Dr. Jade Kush on Instagram as well as on Twitter.
Yes, Jade Tosh, T-O-S-H.
Oh, Jade Tosh, T-O-S-H. Okay, that sounds like it's going to be quite interesting, especially sharing photographs and videos of your work. That sounds very, very vivid. So any closing thoughts from yourself?
To be honest, I feel like we've exhausted everything that we could speak about. But I'm very, very thankful for this platform because people need to know about oral health. People need to know about oral hygiene. People literally need to know everything about the oral cavity. And I think it's also important for me to say, or rather to put it out there, that it is one of the most giving away organs in a body. You know, when you see something in the mouth and you tell the person, look, you can go and find help, it doesn't have to be bad. It really does not have to be bad. Because most of the signs that we see, even for other systemic diseases, for chronic diseases, we first pick them out in the mouth. So if you keep your mouth in check, definitely you're keeping your body in check.
So check your mouth before you wreck your mouth.
Literally, be proud of your mouth.
That's certainly something to smile about. I would like to say thank you very much for sharing your time with us, Dr. Cookie Ngwetjana. It was absolutely great having a chat with you, and even scary as well, knowing for a fact my water consumption needs to increase from now onwards.
Absolutely. I'm going to join you on that one.
Good. It's going to be a team effort now. Thank you very much for sharing your time with us. It's good to have a chat with you. This was all part of the World Oral Health Day 2023, right here on Clicks Live, Revitalizing Radio.